Welcome this morning, and I'm here to discuss the integration of online learning to the didactic portion of dental education. The questions that we need to ask ourselves are, is your institution and are you ready to embrace the concept of online learning? Do you yourselves or does your institution have what it takes to make an engaging online course? Why do we want to have online courses? The students that are coming into education now are considered the DNS students. That's the digital native student. These students have had digital technology basically from birth. They want a reduced amount of time sitting in the lecture hall, the chair time, like we're doing today. Students really have lack of desire to sit in the lecture hall, as I said, and they are learning better time management skills so that they can access their courses and all of the information that's delivered through online presentations. The other issue that needs to be considered is the concept of higher education costs and your institution being competitive in today's market. Offering online and digital courses to your students will draw more of the DNS student to you for learning. What courses could be a possibility to be delivered in an online setting? Well, there's three types of settings that we need to understand. The first one is the face-to-face lecture scenario, as today. The second is the online learning strictly, which is what I did my master's on at University of Maryland, University College. And then there's what we call blended learning or hybrid learning or flipped learning, or the flipped classroom. And what that is a combination of both face-to-face and an online component. So all of our didactic courses that we give, the didactic portions of our courses can be presented in an online format, as well as any preclinical simulation lab information that's going to come across. Both of these are blended learning opportunities where there will be an engaged learner and there will be an exchange of knowledge. This is a study that was done in the West Indies in 2013. There were two delivery modes where a group of students was given, part of the group was given face-to-face lectures, the other was given strictly video presentation. Prior to any of the didactic portion delivered, they had a pre-test and a post-test. The pre-test scores were pretty similar. However, the post-test scores had a statistically significant greater value for the face-to-face learning. The overall results of the study, when the 35 participants were questioned, gave us the concept of blended learning is what they would have rather had. How do we make a didactic course, like today, a face-to-face course, more interactive? We use a program called SoftChalk. There are many programs that are interactive out there. However, SoftChalk has to have a license. At Maryland, we have SoftChalk, and I teach in the periodontal department. We are just, the other hygienists and I are just starting to introduce SoftChalk to our students, whereas the dental hygiene department uses SoftChalk for a lot of their modules that they teach. It is compatible with MS Word. The program, I'm not pushing the program, but the program offers a draw and drag where you can fill in the blank. It is an immediate feedback. So if your answers are wrong, then it gives you a reflective learning and you can relearn, go back a few slides and answer again. There is a mobile application as well. Support is going to be needed. Support is going to be needed to faculty members and support is going to be needed to students. How do we do this? We do it through mentoring and coaching. Need to remember that the average age of a faculty member at Maryland, well, it's general, but at Maryland the average age is 50. I am not there. Mentoring and coaching will be needed for both students and faculty. There will need to be an understanding for the learning management system that is in process in your institution, such as Blackboard, WebTyco. I know that Penn has their own, and I know that University of Delaware has their own as well, learning management systems that have been developed. The concept that needs to be understood is we need to close the gap. We need to close that skills gap in digital technology, as we kind of saw this morning when they were having a fight with the computer screen. What do your faculty need? Your faculty need time to think about alternative ways to present their material, not just throwing a PowerPoint up into the learning management system and leaving it there. They need to be able to adapt to new roles, preparing their instruction environment, anticipating the needs of the students. They need time to be present in the course. When you're offering an online course, you need to have an interaction with your students. So an interaction could be discussion boards. For those of you who are not familiar with online learning, a discussion board is when a topic is generated and then the students respond to that topic. Students respond to other students, and faculty members are also going to respond to that comment. And that does take a lot of time for faculty to handle. There needs to be a technical support means. The IT department, with all budget cuts, is one department that really cannot handle any cuts. And the ideal situation would be for an institution to have a distance education learner. Faculty characteristics. What does a faculty member need? They need to have empathy. Whether there's a problem with your student's computer, they don't understand the question, you have to be on a time where you're going to respond to their emails. You want to be able to encourage your students to be self-directed learners. Our faculty members need to be fluent with technology, and they need to have that mentor, that coach there to help them understand how the technology works. Instructional design is a key component to any course. The course needs to not have an overload of too much media. It needs to have not an overload of too much words on a slide. What do your students need? Students need two things. They need to have communication, and they need to have a sense of community. How do we accomplish communication? Communication can be accomplished, like I said, three ways: a student to student, a student to an instructor, and the instructor to the student. And this can happen in the online arena where there is the bulletin board and the discussion boards and they're responding back and forth to each other. It can also happen when we develop our sense of community. And developing a sense of community is making the students feel that they belong and that they have a place and that they are important. When this happens, a more in-depth form of learning will happen. They will have a sense of belonging to. They will have communicated with other students within their class as well as with their faculty member. There's also a form of reflective learning. They can go back and they can reread, they can repost so that they can say that I understand what the first person was presenting and this is how we could make changes, or I could add other ideas to elaborate on helping to treat that patient. And before I do this slide, an example of a sense of community is when I've run my oral hygiene lectures for my dental students. I'll put up 10 case scenarios, divide 130 students into about 10 groups, and then they've got to respond. And they're going to respond. They have three ways to respond. They have to respond once to an initial post to the case study. And the case study is very simple, short, and sweet. I don't get into any medical aspects because I'm not their only instructor. They've got a ton of instructors. They've got to post to the original. They have to make an original post. And then as the discussion continues, they'll then post to 2 other students. And that way they are earning a sense of community. And this is where your faculty member need to have enough time, because your faculty members need to go in and be able to sit and read. That's usually I do in the evenings or my lunch hours or when I'm overseeing the clinic and they're working and I've gotten them started and then I'm trying to do my own thing. This study by She and Sean is where 51 subjects were studied, and this study basically dealt with the concept of communication in the classroom. And here we learned that to increase your retention rate and your knowledge transfer, the presence of the instructor and the students participating with the open communication, there was a higher student presence. In this study that was done in 2011, it supported the concept for generating the sense of community, making it able to develop a deeper form of learning. Coaching and mentoring, like I said, is very important. Students and faculty members will need it from each other, faculty to faculty members, doing a reverse mentor where you have a a junior faculty mentoring a senior faculty for helping them to understand technology. There are going to be obstacles that are going to encounter, and they're basically going to be technology errors. Designing a collaborative learning environment. Our digital native students, what are their desires? They desire podcasts over lectures. They develop web-based tutorials. I developed a website for our dental students where I have all instrumentation lectures with voice over PowerPoints, videos, and the straight PowerPoint. Now we have a deaf student with us now, so a lot of our stuff have closed capture on it as well. They prefer to go to a website rather than log into the university, then log into the website for Blackboard, then figure out what class they want to go to. By going directly to the website, it eliminates those other steps. It is copyright protected. It has a disclaimer on it that it's not to be disseminated, any of my information, because we do know that we have seen our stuff at NYU. Small group activities are encouraged. Small group activities after an online lecture, examples of that I've done, considering I have 130 students. After I did, I introduced Gracie Curettes and Universals. So after I did all that introduction, and that was all done online, where there was an interactive crossword puzzle that they could do. We got into a lecture face-to-face, divided them up into groups of 13 students. We had 10 groups, and I had 140 short, sweet questions that they could answer in 10 seconds. Each group had 10 seconds to answer it. We had a timekeeper, and I had a scorer with me, and we kept track, and the group that had the most correct answers, I did breakfast for. But it was a fun learning environment, and that's what needs to happen so that you can show the knowledge transfer amongst the students and amongst the people. Blogs, students love blogs, and capturing the lecture, as we're doing today, putting it on the web so it can be viewed at a later time on their own time frame. There's a lot of benefits to online learning. Of course, we're developing a more independent student. Students have to be more accountable for their learning and their knowledge that they learn. Institutions have a benefit that they must stay up to date with technology. They must have staff that understand how to use whatever technology they have, whatever programs are available. This allows for a variety of courses to be offered to your students. It provides a convenient schedule for your students. Some of them have family. Some of them have other work that they do besides they're going to school. It is less disruptive to go back on their own time schedule to review a lecture. It enables the students to be more active learners and develop better critical thinking skills. It can be very cost-effective to a university because the lecture halls don't have to be designed to house 130 students. They can be designed to house less, with being able to have the means to broadcast into another room if necessary. Interactive models, like I said, the example of the soft chalk program, will allow for immediate feedback to the learner. Social media is another way to reach our digital native students. If they're not answering their emails, tweet them. If they need to get a message out to them very quickly, hit them on Facebook. It'll pop up on their phone. An example that I did with Facebook is before I started a lecture, we had just had promotions and they were announced. And my course director was with me, Dr. Shao. And the students I know had not read the email that he got a promotion. So I went to the class president because our classes, each D1, 2, 3, and 4 class has their own website, has their own Facebook page. And we as faculty are not permitted on that. That has been a standard, and everyone has definitely not accessed the students' Facebook pages. We don't want to. So I went up to the class president. I said, send this message out so everybody gets it. I said, and before I start, I'm just going to say 1, 2, 3, and I want everybody to say, congratulations, Dr. Shao. And he had no idea. And when I came up to the podium and I started to speak, I did that. The man was overwhelmed. He just looked at me and said, how'd you do it? And I said, Facebook. And he just shook his head. Listservs. Many professional associations use listservs to disseminate information. What's important to know that listservs are not peer-reviewed. So the people posting to listservs can post anything they want. Now, Dr. Ferguson, skip the slide of EHR. My concern is electronic health records. The program that he's developing, that he's supporting and he's going to go lobby for, has got to be EHR. It's got to be electronic. It is.
It exists.
That's great.
That's the name of it.
Okay, perfect.
It's not a concept. It's in use.
It is in use, and it is electronic.
Yes.
Okay, that's great to hear. Perfect. Well, in 2004, for those that are not from the U.S., that is when President Obama wanted all medical and dental records to be electronic. The key features for this is that it's computerized prescriptions, computerized lab tests. The doctors can read each other's notes, because I can tell you when we pull old charts and we're trying to read the information, handwriting is definitely an issue, and I am guilty of that. In 1996, that's when the Insurance Portability and Accountability Act came in that would help to support the electronic health record. EHRs are automatic, and it automates and it streamlines the clinician's time, the workflow. Digital dentistry. Digital dentistry is here. It is alive. We all know that. In 1973, the French PhD student Francois Duret gave the first, his thesis was on optical impression. Today, digital dentistry, we can do crowns and dentures in one visit. We can mill a denture. We can mill a crown. Digital imaging. Does anyone know when the first digital radiograph, intraoral radiograph happened? First digital radiograph intraorally was in 1987. Digital dentistry is alive. In 1995 was when the first extraoral pan was taken. Digital images are not radiographs. They are called digital images. They are not a radiograph. That's a key word that is not clearly understood. Information is available to our students 24 hours a day, 7 days a week, and 365 days a year, because it would be on the web. It would be in a secure environment, in a learning environment, or on a website. Like I said, digital dentistry is here and alive. The educational arena needs to jump into the bandwagon and become more interactive with online learning. There needs to be more faculty development. There needs to be implementation, and there needs to be evaluation of all and every online course. Thank you. And are there any questions? Yes. Wait a minute, the mic's coming. 1 second.
If you have 130 students, as you mentioned, you divide them into 10 groups. Do you need more faculty?
I need more time. Do I need more faculty? It would be ideal. I have another hygienist in the department with me, Perio. We have our D1 students. We introduce universals and assessment, probing, keratinized gingival, CEJ, mucogingival junction. That's introduced in the D1 year. The D2 year, I do oral hygiene and Gracie instruments. When we do discussion threads, it would be great if I had Oksana Mishler with me on the discussion thread, but it's easier if it's just one person in there. It takes time. It just takes a lot of time to sit and read and screen through it. A lot of the students, they do respond. They do like when they hear that I've been in the classroom, because the word gets around really quick. Miss Liberman, she's been in our forum. And have you responded? And the learning management system, it'll clock. You can program it so that it can clock that each one of your students did the actual 3 posts that they need to do. Because if they don't do the 3 posts, they get an incomplete. I'm not afraid to post it, and I don't take any excuses for it. They've got a small time span of window. I usually give them 7 to 10 days to respond. And since I'm in a doctoral program, I try to run that when I'm not in a class, so that my time then is definitely devoted to them.
Question, please.
Yes.
I'm from India. We do use digital records. I do keep my patients' records in digital format. When you speak about only digital records, can you follow what I'm saying?
I didn't catch the last word. You use digital records?
Yes, I do.
Okay.
And I also have paper records.
And you also have paper records?
Yes. The issue here is that if you put everything on the net and someone hacks into it, where is your confidentiality of the patients? That's a very big question I have always.
That is a question that that everyone is faced with. Internet security is a growing field. I know that to get into, I can tell you that we have been in the new dental school where we built a new building and it was completely digitized. We have been in the new dental school since 2006. We have been completely electronic records since 2008. And in 2008 till now, we have not, I shouldn't say this, we have not been hacked. Now, where we have our problems is when we get the upgrades, because then things go haywire. But we no longer, for the first, I would say maybe 2 years, we're still pulling paper charts as well as the digital. And now we don't even pull digital charts, well, I mean, our paper charts. Only time paper charts are pulled, I can tell you, is I did a research study with arrestin and implants for periimplantitis. And I needed my paper records for that because I needed all the information on what implant was placed and bone graft material. But we have not had an issue with being hacked, which is good. Yes?
Stonebrook, I think, was the first school that
You haven't either. Do you use Axiom at there? Yes. We all use Axiom. Majority of us use Axiom.
Last question. I'll take the prerogative. For someone who's contemplating for the first time integrating e-learning into a didactic course, what would be your advice in terms of the amount of time to set aside before looking at a launch? What's a reasonable project planning time? And then who should you surround yourself with, if possible, to help you make that integration?
To do an online course, you need to work with someone. If you haven't, the problem is our senior faculty have not done any online courses. So this is where reverse mentorship comes into play. We need to move a junior faculty up with a senior faculty so that they understand what goes into the online classes. Then our senior faculty need to understand and sit with our IT people to help them to develop the course. I would say before a course can go live, before my website went live, I would say it's a couple months of preparation. Because the biggest problem is they already have their lectures. They edit their lectures. They update their lectures. And they don't want to change their lectures into a soft chalk format, because it means converting to plain text, and then it means integrating it into the program, and then it means making a whole nother thing, and they don't want to take the time. And to be honest, with the cutbacks that we've had in education, the time it takes to develop an online course is significant, and the problem is that the administrators need to be more open to that. And this is not just at Maryland, because our administrators to this point, my director is Dr. Ashraf Wad, and he's extremely supportive of online learning. So the problem is it needs to be universal at dental schools. They need to understand that it does take time to generate an online class. And they will be faced with this more and more as the generation X and Y start coming to us. And if they don't address it, the word will get out that you don't want to go to such and such a university because they're going to make you sit in a classroom.